Hello and welcome. You're listening to Health Professional Radio. I'm your host, Neil Howard. Real glad that you could join us for another segment. We're going to be speaking with Dr. Edio Zampaglione this morning. He's joining us here from Organon, and he's going to talk about some unintended pregnancies, the importance of starting conversations about birth control options with college-bound students, and a little bit about a brand new study published in the journal Pediatrics. Welcome to Health Professional Radio, Doctor. Thanks for joining us this morning.
Thank you so much, Neil. Thank you for having me.
Now, I mentioned that you were here from Organon. Give us a bit of your professional background and talk about your role at Organon, if you would, briefly.
Sure. Thank you. Neil, I'm an OBGYN. I was in private practice for a number of years before joining the industry about 20 years ago. I currently head up global medical affairs and outcomes research at Organon.
There are many pregnancies that are unintended. When it comes to unintended pregnancies, are most of them unintended?
Well, unintended pregnancy is an all-encompassing word. It really comes to, those that are mistimed or those that are truly unintended. So it's not a matter of that each one would really be unintended. It could also be a situation where the timing just is not right for that woman or that couple, and it just that they would have preferred to delay things a little bit. But usually it is occurring where the pregnancy was not wanted to happen right at that time, I guess is the simplest way to explain it.
Now, even though the pregnancy wasn't intended at that particular time, we persevere, we make changes, we adjust, we sacrifice, that sort of thing. But if the pregnancies had been discussed prior to, a lot of decisions, may not have been made at that time.
That is correct. A lot of studies and a lot of data have shown that with unintended pregnancies, the prenatal care tends to be a little bit less. The pregnant woman sometimes, may be a little bit of denial, so may delay the prenatal care. So just from a health reason, also preparing for a pregnancy is very important. A lot of times, unfortunately, these pregnancies, tend to be a little bit more on the difficult side.
Aren't schools still teaching a little bit in sex ed or anything like that? Is that still something that is being taught in schools today?
Well, yes, it is. I think over the years it definitely has increased. There's a lot more awareness. A lot more parents and children do want to have that teaching, do want to have that awareness. However, unfortunately, while there is that desire and there still is it is happening, it still is not happening really as routinely as it should, or really to the degree that it should.
I can understand a little bit of apprehension to discuss such things in say, high school, middle school. But as we get older, when do you think is the opportune time to really have that serious conversation with young people, or at least among young people?
Well, Neil, that's a very good question, a very important one. Really, it should happen early on in the adolescent age. There was a study published in Pediatrics that shows that conversations about sexual reproductive health, other than puberty, they really aren't happening routinely, and that really is a missed opportunity. Every child, everybody's different when they start becoming sexually active, but you want to have that discussion really beforehand. So having that discussion early on, again, as they're getting into the late grammar school years or early high school years, it does not have to mean that they are going to be sexually active or implying that the child is, but just having that awareness, having that understanding of what they need to do to protect themselves, what they need to do to protect themselves from sexually transmitted diseases, all such very, very important things that should be taking place at a relatively early age early on in their adolescent ages.
Now, as that can be a difficult conversation, how often are healthcare providers asked to get involved with the child? The pediatrics practitioners, are they routinely requested that, hey, can you help us out here? Or is that too difficult a conversation to have, especially for the child and for the parents to even ask?
Well, that's part of really what I'm trying to bring a lot of awareness out. You really cannot rely on the child or the parents to initiate it. We are all pediatricians. We're all healthcare professionals. So while it can be difficult to initiate that discussion, a lot of what we do in medicine can be difficult, and we need to overcome that. And the main way of overcoming it is asking the right questions of the let's call it the patient, okay? Asking the right questions in a very non-confrontational way. There's many educational opportunities for different healthcare professionals to get that training on how best to approach it, how best to ask the question, where you're, like I said, in a non-confrontational way, or in a way that makes that patient or that child feel much more comfortable with the conversation. So yes, it can be challenging, but not something that cannot be overcome.
Now, when kids graduate high school, many of them head off to college. A lot of them are going far away from home. Sometimes far away might even be in the same city, depending on, the situation. But basically, they're on their own. They've had a conversation here or there in high school, maybe with their doctor, maybe with their parents, but now they're on their own and they've got to put some of these things into practical application. Is it important to reiterate or even start that conversation as they head off to college?
Oh, absolutely. I mean, this is it's an important time of their life. This time of year is very important, and that's why, first and foremost, if they had that conversation early on, at least there would be an awareness. They would have some level of understanding, and obviously as they mature, that level of understanding and the amount of information they would be reading would increase. But it is very important. And you bring up a great point, Neil, also. They are leaving the house, okay, whether it be just in the same city or across the country. These kids are on their own. So one of the biggest concerns I have as an OBGYN in my role now at Organon, and even as a parent, is where are they getting that information from? What sites are they seeing on the internet? Are they reputable? Do they have the right information? Or is it things that are continuing to perpetuate some of the misperceptions? And for me, that's the scary point. And it gets back to why it is important that the provider really does initiate the conversation, ask the right question, provide the right resources and guidance for that student or that patient.
Give us a website where we can learn more about Organon and maybe about some of these decisions that we've been talking about. Maybe it's a little bit of guidance. And I understand that the study, if I'm correct, was sexual and reproductive health discussions during preventive visits. Is that correct?
That is correct. It's in Pediatrics, is the journal, and it was in this month, actually, August of 21. And yes, sexual and reproductive health discussions during preventive visits. So, there are a multitude of websites. The CDC actually is a great website for Organon. Organon.com is where people can go to learn a bit more about our company and our mission when it comes to women's health. But as far as websites for the students, the patients, again, like I said, CDC has got a great amount of information. But there's other ones. Bedsider.org is another really, really good one that has a lot of patient-friendly information. But the best avenue for this and the best source of information is their healthcare professional. He or she would be able to really guide that person where, depending on their age, depending on where they are in their own reproductive life and what they're looking for as far as goals and dreams, let's say.
Doctor, I appreciate you joining us here on the program. Thanks, and I'm looking forward to our next conversation.
My pleasure. Thank you so much, Neil, for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Edio Zampaglione. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.